All right. Well, I think we can go ahead and get started. Introduce ourselves and start getting into it. So, Jing, you want to kick us off and tell everyone a little bit about yourself?
Okay, sure. So sorry for the camera. I was just stuck in traffic, like one of those days we all experience. But anyway, so I just got back to the office, so I will start the camera shortly. So in any case, and yeah, my name is Jing Zhu. I'm one of the co-founders of Duet, and we are based in California. So just a little bit about myself. I got into So like I learned about NEMT years ago. One of my family members missed her doctor's appointment, which took us 6 months to book. That was actually the incidents I learned about the industry. And then for the last 6 years, I have been working with Duet and helping our customers managing their services. I actually personally give me 1 second. So I personally managed 6 operations in 5 different states. They're all very different operations, from 100% hospital discharges to 100% broker trips. So really excited to have this opportunity to share my experience with you guys. All right, so it's a little bit about myself.
Yeah, and I come in from the healthcare strategy consulting side. And Duet is a dispatching software for non-emergency medical transport. We do, dispatching, scheduling, booking, billing, and as Jing mentioned, also help like have some remote dispatchers that manage operations. So a lot of our knowledge of the space has come through like actually on the ground, taking calls and such. So let's go ahead and get started. So you guys all, you're here at TTA because you know how to run a transportation service, but maybe you're curious about getting into non-emergency medical transport or going deeper into non-emergency medical transport, maybe getting into wheelchairs, getting into stretchers. Each of those have their own challenges. And of course, when we're talking about NEMT, we're talking about, those kind of wheelchair stretcher trips. One of the big differences is that the payers are very different. NEMT is a very sort of B2B business where most of the money is coming from Medicaid, coming from private insurance, coming from facilities. Certainly, I have paid for my grandma to take a non-emergency medical transport ride before, but that's a small portion of the overall market. And a lot of what we're going to say will also apply to access transport and paratransit. Whether you're taking someone in a wheelchair to the grocery store or the doctor's office, a lot of the same things apply. And I also want to mention, like, please go ahead and drop questions in chat anytime. We'll save some time for questions at the end, but especially if it's relevant to the current topic, like throw it in there and we'll try to answer it. So my first question for Jing, Jing, sort of why do NEMT at all? What's the appeal of it compared to just running a taxi service?
Okay.
Okay.
Give me 1 second. So I think Rebecca, I trying to join through my okay, never mind.
Yeah, we can see you,
So
Jing.
okay, yeah, no worries. So I will just use my mobile, so I'm back to the
No, we
office.
could see you on the computer.
Oh, really?
Yeah.
Oh, sorry, I just quit. Anyway, so I'm on my mobile. I think if you guys can hear me, that's totally good. So yeah, actually, NEMT is a really fascinating market. I've been there in this market for 6, 7 years. There are a lot of changes. So actually, before NEMT, we started in last mile transport. So we've been working on the B2B side of the transportation services. So I can see the differences. So one saying actually I want to use, I like is, I forgot which US president said that, is follow the money. So that's actually which one, I would say I like this thing is because the transportation service, the way the service is managed has a big influence. It's really influenced by the payer side. So for the NEMT service, the payers is actually very different from B2B, which like corporations, or B2G, government. So the payer decide how the service is it's managed and provided. So well, in NEMT part, industries, the payers, most of the payers are actually health plans, Medicaid or Medicare through managed care organizations, or a lot of like workers' comp, and even the auto insurances will pay. So those payers, they are actually healthcare payers. So they really have a big influence on the industry. And then because it's very much a healthcare driven services. So there's as you all know that we have an aging population, and the people who live with chronic disease. So that population will be double in the next 10 years. So there's a growing need for this service. And another thing about NEMT services that actually makes it very unique is that the requirement and the regulatory compliances. So because most of times we are transporting very vulnerable, I call it vulnerable passengers. So they are sick, they are bedbound, they are wheelchair bound. So there are very, very strict compliance and regulatory requirements for providers. So well, that had a lot of complexities for the operation, but the beauty also, it's actually, it built I call it watered garden for the providers. So ride-hailing services like Uber and Lyft, it's now so easy for them to get into this market. So it's a fairly protected market as well. And another thing actually make NEMT both unique and I was actually attractive for providers is really, it's not just about transportation. I know actually a lot of people view us as transport providers, but actually there are a large component of the services is actually healthcare services. So the drivers had to be really providing this additional support. For instance, people with walkers and canes, the driver will go into the offices or somebody's home to walk with them all the way to the curb and help them get into the vehicles. I mean, also like wheelchairs and the stretcher transport. So those additional services, that's actually fairly unique to this market. And then that's make this service really important.
Thanks, Jing. So let's say I'm totally sold. I've got my taxi company. I'm ready to get into NEMT. My first reaction, I go on Facebook, I ask everyone, hey, should I do ambulatory? Should I do wheelchair? Should I do stretcher? Somebody tells me, well, stretcher has the highest margin. I say, okay, I'm a strong guy. I can do stretcher. I go out and I buy a stretcher vehicle and get going. Is that likely to succeed? What could go wrong with that plan?
Well, actually, well, one thing about NEMT is there are a lot of things that can go wrong in the services. So one thing I see a lot of providers do, and then many didn't do, it's really truly understand your market. Okay, each market is very different. Like I mentioned, I have intimate knowledge of like 6 different markets. Like even within California, we're based in California, so we manage 2 operations in California. They are like 100 miles apart, but they are very different markets. So I would say actually when you started, understand your market. Okay, so a couple of things actually in terms of understanding the market, because a lot of people say, hey, I grew up in this city. I know every single street. I know every single corner of the city. How do you say I don't know about this market? Well, actually for NEMT, it's not about knowing the streets, knowing the routing. It's really about knowing the economics as well as who are in your market that plays a role in the services. So I mentioned earlier, the payers are really important in the market. So the first thing you want to know actually who are the payers in your market, and the largest payer in NEMT is Medicaid, and typically Medicaid is managed at the state level, sometimes at the county levels. So you want to know in your local market what's the Medicaid office status. So are they managing the transport service on their own, or are they using brokers? Who are the brokers they are using? Are they using one broker or multiple brokers, et cetera, et cetera? So these are the first thing you want to know. And then another, the second one you want to know is, okay, so you know the population or are you your market, like whether you are in urban, suburban, or rural market. So this is very clear. But you also want to know who are the healthcare providers in your market. Okay, how many hospitals in your area, and those are large hospitals, and then dialysis centers in your area, and then how about the nursing homes, skilled nursing facilities, senior homes, assisted livings. So you want to actually understand, do you have a lot of those facilities, hospitals, clinics in your areas? I mean, if you are fortunate in a very urban area, yes, there are actually a lot of them where they are. So you want to know that. And then if you are in a rural area, it doesn't mean like you barely have like a clinic in your town. It doesn't mean you don't have opportunity. Actually, I was surprised one of the operation I support, they are in almost a rural area. They actually have a lot of trips because the nearest hospital is probably 50 miles away. So they have a lot of long trips, long distance trips. So there are quite a bit demand. They just don't have enough providers in the area. So you can be the big fish in a small pond. So like this is one thing, is knowing the demand, and then based on that, the one last thing is you want to know the pricing point in your market. Like a lot of people are saying, okay, like they go on Facebook or they go on Google, they go on chat room. They say, oh yeah, actually, stretchers. Everybody's saying, like James mentioned,
Mhm.
everybody's saying, oh, stretcher is a good margin. The trip has a high margin, so I'm gonna go with the stretchers. But from what I have seen in the market, I've seen the price of stretchers from like $100 a trip all the way to $500 a trip. So really depending on which area you are. So in California, there are some areas so competitive, like people are to $100.
Mhm.
So you don't want to just go with folks on Facebook or social media telling you. You want to actually do a lot of research in your market to understand who are the payers, who are the healthcare providers, bigger population, the demand, and also the pricing to decide whether like what kind of service you want to provide. And then the pricing also varies from the level of services. Okay, so wheelchairs,
Sure.
ambulatory wheelchair, and stretchers, right? So like like for instance, 3 years ago, like in Massachusetts, nobody wants to actually get into wheelchair trips because the pricing is really low. And then the Medicaid office increased the pricing payment, the wheelchair price, and then there are more and more wheelchair services in the states. So this is all part of the understanding of your local market.
So I talked to someone last year who, more or less figured it out, decided what kind of service he wanted, where he was going to do like wheelchairs or something, and bought 5 vehicles, started paying for insurance, hired drivers, and had no rides set up, which I think, caused him a lot of grief. What do you think? Obviously, it depends on the local market, but what do you recommend in terms of how do you go out and get trips when you're starting out in NEMT?
Okay, so this is a really interesting questions. What I have seen, there's a different ways you can start. The way actually I would recommend is leverage your strength, right? We have seen folks who actually who have been in EMTs before. For instance, they have been drivers or dispatchers helping other services to start it, and then they want to branch out to start their own services. So that's something actually a really valuable experience and the network you can leverage, because if you stay in good terms with your previous employers who are NEMT providers, you can be their backups. They can overflow the trips to you. So that's one. And then there are quite a few providers who have healthcare background. So folks who are nurses, used to be nurses, or working in hospital system, they understand that there's a huge demand or need for this type of service. And they have a big networks in hospitals. If they want to sign contract with hospitals or health plans, they know who they can call, and then they can get the meetings, they can get in fairly quickly. That's a great leverage. And then we also have seen folks already providing a tangential or adjacent service, for instance, home care services, right? I mean, they see great needs for transportation. They started a transportation service so that they can actually can cross-sell or have it, because these two services have very strong synergies. If they pick somebody up from hospitals, drop them back to their home, if they see the person doesn't have anybody at home to help them recover, so they can actually bring in their home care services. And then I have also worked with providers who's completely brand new to this market. They just know, okay, I want to start a service. I know this is great opportunity in this market, so I get in there. So but they still have they bring in their own skills. For instance, I know folks who actually not only brand new but also very shy. He just couldn't make a cold calls. He is very shy of going to meeting people strangers. So what he did is he can just scrape Google or Yelp, get a list of facilities, and then he hires somebody to call. Each facility to get meetings for him. But he's very good in terms of managing operations, recruiting drivers, managing drivers, and then have a very tight ship. So he is still successful. So there's a different ways you can get into NEMT. But one thing I want to cautious the new providers in the market. So obviously this is depending on each market. So the successful so far, the most successful formula is to start with small, okay, with one vehicle, two vehicles, and then in many markets you can start if you only have one or two vehicles, you actually can start with private pay fairly successfully and get very busy with private pay. And then once you learn the rope using private pay, you can go up and start signing with facilities and hospitals and brokers. So this is actually a kind of common path for a lot of providers to get started with. So and then you understand your market. Once you start doing trips, you have experiences, you start building the networks, you understand the market much better. Then you can decide, okay, you want to either more vehicles or you want to move up the value chain, providing high value trips like wheelchairs or stretcher trips.
Yeah, and I should mention we did a webinar last month about specifically how to grow your private pay practice. So just reach out to one of us after. We have a recording of that if anyone would like to see it. So let's move on to the next topic. We touched on this before, but I really want to dig in because this is a very important topic. Okay, so I'm a taxi company. I've bought some NEMT vehicles. I'm starting to get rides. I'm not sure if I've got my pricing right. Maybe I've started out saying, okay, it's going to cost me, $25 to do this ride. So I'll charge, $35 to the person, or the facility providing the trip to me. Is that reasonable? Do you like that kind of cost plus pricing, or is there a better way to do it?
Well, there's nothing wrong with cost plus pricing. It's one of the pricing strategies. If you go to any marketing courses. So one thing is what I like. I think actually last time when we had a webinar with Henry, and I really like one of his comments. He said the price actually is not determined by providers; it's determined by market. Okay, so collectively by providers, not by one. So you have to understand your market. This is part of understanding of your market, like all the pricing, like for different type of services. And so for instance, I mentioned earlier, because I involved in operations across 5 different states. So I've seen like for wheelchairs, I've seen price from $35 to all the way to $85, and then stretchers from $100 all the way to $500. So this is not like the providers in California wants to take $100 if they like it's so competitive in that market. So the pricing is just that low. So first thing, like really understand the pricing in your market. Okay. So
Great.
maybe you want to ask me like, oh yeah, so how do I know the prices? So one thing is they call it a secret shopper experiment. So just call 3 to 5 providers in your market, and like with the same trip information, and then in a couple of hours you will understand. You have very basic baseline of your what the markets what the pricing look like in your market. And but those most of them are a private pay rate. In most cases, actually, private pay are slightly higher than contract pays, because contract pays, if you have contract with the brokers or facilities, they give you like more trips. They will probably some of them you promise you certain volume of trips, so they will negotiate a lower prices. So like, but still understanding the private pay rate in your market, that's typically an anchor rate for all the contract rate as well.
So, sort of justifying a higher price is a very complex topic, and I don't want to get into, spend the whole webinar on it. But what are your top tips? What are things you can do very quickly to position yourself as a premium service that can justify a higher price?
Actually, pricing is really interesting. It's more art than science. So there are two ways actually I've seen people bump up, like actually negotiate a higher price. The first one is a scale. Like we have talked with the providers who have like a fleet of 50 stretcher vans, so 50 stretcher vans, and the insurance trained drivers, large operations. So and then when he told me the price, I was actually surprised. I said, "Wow, yours is at 25% higher than the rate I heard in your market." And then he said, yeah, actually, the largest hospital I contract with, they even want to pay me more. I said, oh, really? And then, well, the reason for that is if you think about it, hospitals or health plans, right, when they managing their transportation service needs, they typically hire a team. Like a big part of that team are call agents. They will call a bunch of providers to see who can take this trip. So that's actually a lot of work. So if you contract with a very large fleet, like this person who has a fleet of 50 stretcher vans, so like the chance of you get availability or that person take that trip is almost 90%. So which means actually, so if for hospital or health plans, that means actually they can reduce their operation cost significantly if you hire a very large fleet. Okay, so instead of hiring like 10 agents, 10 agents calling like 24 providers to find the availability for this trip, I just call one, and then 90% time that I'm done. So that's great. So you reduce your operational cost. That's why you can actually justify to pay this person higher. Literally, I mean, in essence, you transfer the the logistic management cost
Yeah.
from you to the provider. So, but that's on the flip side is actually as a provider, I mean, maintaining and setting up a fleet of 50 stretcher ones is not a trivial thing, right? There's the capital outlays
Sure.
as well as the managing the operation part is very, very intense. So not everybody, I would say 99% of providers won't have this kind of capital or
Right.
experience
I
to
mean,
manage. Yeah.
and even in that kind
So,
of situation, I've seen people justify higher price, like with a smaller fleet, I've seen higher prices justified with like really friendly, really good drivers who are super understanding, especially on the private pay side. I've seen very sort of people going to facilities and marketing like, hey, we've got really clean, modern vehicles. Take a look, they're beautiful. I've got one parked outside. And sort of justifying a higher, the drivers have uniforms. The dispatchers are very responsive and quick to take a booking or reject a booking when they call. Um, and I guess one more point
Mhm.
about, without getting into sort of changing your whole service, do you have any tips for sort of just little pricing tricks you can do to get
Yeah.
more out of your current system?
Yeah, actually, I have a couple. I do. So, for smaller guys, right? So, like, there are actually a couple of pricing tactics you can use. One is actually change how you price your trips. Okay. So, for instance, both James and I offer. So, James offers like $20 base and $3 per mile mileage fees. So, when I negotiate the contract, I do not want to be price my trips exactly the using exactly the same formula, like a base and mileage fees. What I do is I will actually use a different formula. I use tiered pricing. I can tell the facilities or health plans, I will do like $30 for the first 5 miles, and then 30 for the next tier. I'll do $30 and then plus $3.25 per additional miles. So once you change the price formula, it's really hard for folks to to compare you
Yeah,
and
and
with
then
the
then you
other
can
one.
differentiate on like, driver uniforms and modern vehicles and everything, and they don't have it doesn't turn into a price war.
Yeah, exactly. So another way you can also do is you say like if James offers $100 for gurney trips, so then I say okay, I'll match that. Okay, but only for the first 2 or 3
Yep.
miles, and then I'll add layer up all the additional fees. I will say okay, if it's a bariatric weight, I have to charge additional $20. If you need to use my oxygens, I would need to charge another like $15. If actually you book it off after 5 p.m. Off my operating hours,
I've
additional
seen people
charges.
charge like per stair that the driver has to go up or down. Yeah.
Oh yeah, yeah, exactly. The per If you have a 5 steps per step, I have
Yep.
additional charge. You can layer up those additional charges. And then, so if you have a good software, like you can give them a breakdown fees in the end. They will say, "Hey, I thought you only have $100. How come you charge me like almost $200?"
Right,
Then you can
sure.
say, "Hey, this is the situations." So this is a one tactic. Basically, use a different price formula, and then another one actually you can try, I've seen folks trying it fairly effectively, is really adjust your service area, quote unquote, your service area based on the rate. Because sometimes, if broker James come to me, say, hey, Jing, I'll pay you $20 base, $1 per mile fee. Okay, then I will say, hey, James, I will take that. I have to take that price because you're not barging. So, but unfortunately, my service area is only like I only want to do within 5 miles of my parking lot. Okay, so I only take short trips in my local area because I want to go after $20 base. That's the most profitable part of the formula. And then $1 per mile, it's really low. So I will shrink my service area to get more trips. So I can pack my more trips in an hour for my drivers. Okay, and then if a broker James tell me, so hey Jing, I'll pay you $10 base and $5 per mile. So I will
Mm.
say sure. But my service area is about 50 miles. Okay, so like give me like long trips. So because the $5 per mile is actually the profitable component of this pricing. And then, but I don't want to do more than 50 miles because I'm not getting paid for the deadhead miles.
Mhm.
So if I go too far, then I have to eat the cost to get my driver back to my service areas. But if James tell me, say, hey, besides like a $10 base, $5 per mile, I'll also pay you $2.50 per deadhead miles. And then I'll just say,
Right,
hey,
yeah.
my service area is as far as you want me to go. So
Yeah.
so that's one another way. Just adjust your pick and choose the type of trips you get. you want to
Great.
take based on pricing.
So let's talk about operations. Well, we've got 30 taxis here. Can I flip a switch and start doing NEMT? Like what are the biggest things I've got to deal with?
Well, NEMT actually operation is very different. I mentioned earlier, we actually did a little bit of last mile with business parks before we completely switched to NEMT. So we see the differences. Okay, so there's obviously the vehicle types are different, especially if you go up to wheelchairs and stretchers. The vehicle are different. The equipment requirements are different, and then also the insurance risk is different, right? So like if you look at both wheelchair providers, some wheelchair providers will say, hey, I can only take that wheelchair when the patient's already in wheelchair. Okay, and then the others are, yeah, okay, I can help you move the patient from couch to transfer patient from couch to the wheelchairs because they have different levels of insurance and they can take different levels of risks. And also probably like also need different drivers. So all of them, all the drivers need like there's a good reason, right? All of those actually differences are really set up for a very good reason. So that's because of to protect the patient's safety,
Mhm.
and also to large extent to protect your business like too. So
Yeah, and I've heard horror stories of drivers who lock the wheelchair in and don't know you have to like tie it down and secure it during transport. So that's again a whole nother topic. I want to
mhm.
zero in a little bit on the booking side of things. Like it's pretty intuitive to take a pick up address and drop off address
Yeah,
for a taxi, but what do I need to do in NEMT? What do I need to collect when I'm
well,
taking a booking?
yeah, so let me yeah, let me I'll talk about booking in a minute. So I want to actually just highlight the driver trainings. This is
Mhm.
actually really important. Almost every operations like wheelchair operations I support, there are at least one incident the driver like forgot to secure wheelchairs, and then patient got like either minor or like a scare or minor injury or like some more severe injuries. In this case, it's not just the patient got hurt, but also actually it can have very big financial impact on the business as well because like your insurance can go up quite a bit. I've heard the stories that there's a big accident, and then the provider's insurance doubled and tripled. So basically, it wipe out all the margins, basically wipe out the services. So driver training is really important, and also like you mentioned, like the difference between NEMT and other like town car or taxi services. I would say actually the NEMT kind of require different type of drivers. So I work with a provider who are in New York City. Um, so he used to run a very large town car services, and he decided to dab into EMTs, and then so he started very soon, like within a month, I saw like one by one, like his driver left. It's because actually this type of NEMT service is really different from town car or taxi service because driver has to provide a lot of besides driving there's a lot of other services or support they need to provide. In addition, because we are transporting patients, a lot of patients they're under their own healthcare, health stress, distress, and they are now in their best self, so
Mhm.
they can be rude or they can like complaining or they can even sometimes be violent. So this is it's not really it really requires a lot of compassion from the driver's side.
Mhm.
It's not easy job, so you do need to hire uh, accordingly. So okay, so let me
Yeah.
talk about a little bit on the booking side. So I would say I want to tie it with really the staffing your operations correctly. So I have a story. We have a provider whose family owns a very successful airport shuttle services for decades. And then she worked on that business for a few years, and then she ventured out to start a EMT business, and then growing the first couple of years, growing really well, and then she's getting really busy. So she poached the best dispatchers from her family. And then after 3 months, that dispatcher quit because it was just so different. The dispatching, the operation, the entire service management is just so different from their previous service. So the dispatchers couldn't take it. So I always feel like after doing it myself for a few years, I always feel the NEMT services. I mean, granted, probably like other town car taxi services, probably the same, but especially for NEMTs, there's so much details, okay, of a trip, and then the attention to detail is requirements very, very high, and then almost the margin of errors also very, very low. So like something really like obvious, like for instance, uh, if somebody cancel the A leg trips, you have to remember to cancel the B leg, right? So something or A leg is a no show. The B you need to remove the B leg, otherwise you have a dry run. So some small things like that, and also the part of a large part of the operation staff in the office, the large, big responsibility is really taking booking calls. So that's one thing about NEMT is that large part of the business, your trips, most likely will come through calls. So even if you use brokers, a lot of those bookings or trips will come from the calls. If you contract with facilities, definitely 90% come with the calls. Hospitals, ER discharges all come with the calls. There's a good reasons because there are a lot of information you need to communicate, and then a lot of questions you want to address on the call. So call is more efficient. So which means actually your office staff needs to have this call skills. It's not just taking the name and the pickup time and pick up and drop off addresses. It's really a lot of questions is surrounding about the trips. So you want to get enough information to prepare for the trip. For instance, if it's hospital discharges, like it's a wheelchair discharge, you have to ask whether the patient has wheelchair or not. Okay, if they don't, you need to provide a wheelchair, and that piece of information the driver needs to know. Otherwise, can you imagine like 7 p.m. the driver has already done like 10 runs, and then now he ran into the hospital and then found out the patient doesn't have wheelchair. He has to run back and then run back. So there's he does like a 2 laps of runs, and then takes 30 minutes. And he's so tired, he's hungry, and he's not going to be your friend for the next 2 weeks at least. So that's the information. And then like there's if you again wheelchairs, right? If you have to ask a weight because bariatric versus regular wheelchair is different. You have to ask what type of wheelchairs they take, because powered wheelchair versus a regular manual wheelchair versus like an actual wide wheelchairs really impact your scheduling and dispatching. So all this information you have to collect. And then on the, okay, oh, sorry.
I was just going to ask, and then like, obviously you've built all this into Duet as part of the product. How long does Duet sort of store this kind of information?
Well, typically, this is a really good point. Your software tools should help you managing this part really efficiently. So basically, all the information you collect the booking calls, there are two purposes. One is help with your operations, so you know actually what kind of trip it is, so you can prepare the drivers or vehicles for this to support this type of trips. And then the second reason is really for your billing purpose. Okay, so
Yeah,
like a
maybe we
lot of
should flip to the billing slide here. Or go ahead.
yeah, actually, yes, we will talk about billings, but now I just want to talk about the booking part
Okay,
because
sure.
yeah, most bookings come from the calls, and then but the billing will have additional requirements. Some billings require, okay, like hospital discharge, they typically ask you some numbers like medical record number, transfer number, some numbers so they can link this number with their system. They know exactly which patient you transported because they might have 10 John Smiths in their system. So they want to know which John Smith you transported. And brokers may need the trip IDs. And then like hospital, like health plans may need date of birth and their membership ID, authorization ID. So every payers have their own set of data they have to have in order to pay you. So that if your trips all come from the cost, so you know you have to collect this data, you have to put it in your software, and then that your technology tools have to support not only your operation, but you have to be able to pull those information very quickly for your report, so you can build it quickly. So yes, you definitely need a good technology tools to organize, to first of all like help you collect, organize, and save those information. So for you both your operation and the billing support. And then
So
another thing, actually, I do want to mention this, is the operation staff requirement is pretty unique and very strict for NEMTs. Another thing is, so even though you have to collect a lot of information, but the thing is, the booking cost has to be very short. So that's the thing. That's the challenge of actually typically for new dispatchers or new staff members. It takes very long time for them to get used to this, because if you like spend your sweet time, like if you spend 10 minutes on a call just to take a booking call, very soon you will see the facility or hospital, they will stop calling you, because a lot of like hospitals or facilities or like health plans who manage their own transportation, they have a quota, like especially health plan or brokers, they have a quota for their agents. You have to push, like you have to call like managing 50 or 100 trips a day. So like they cannot, those call agents, they cannot spend more time with one providers because they have their quota. So that's one of the reasons actually the office staff requirements is really high. Like you need a very experienced staff to help you managing the operations.
yeah, and like the best dispatcher in the world can remember in their head where all, 20 NEMT vans are at a time. But we've built Duet to be very sort of easy to look at and look at the calendar view, look at the map view, and sort of understand, even if you're not the best dispatcher in the world, understand within 10 or 15 seconds whether you can take a trip or not.
Yeah.
So let's jump over to billing. Um, so I've heard some horror stories on billing where, people lost, 25K, 30K due to like, failing an audit because they were missing information. Tell us about sort of the biggest differences between, NEMT billing and something less medical.
Okay. So I mean, I like the way you're saying less medical. NEMT billing is medical billing, or I would say it's medical billing in disguise. Because sometimes you don't know, you thought the nursing home will pay you, but actually a lot of times nursing home will bill to insurance, and then when they get paid, they will pay you. So understand the billing is really important. Don't take. I would say billing is probably the most underestimated effort in for a new provider when they get into this market. They like I mean, like for instance, if I used to run taxi or town car service, the billing, like especially B2C consumer service, I got paid right away, right? The credit card charge happened right after the trip finishes. But in NEMT, the billing is not a given. That's why there's a reason they call it reimbursement, because you provide the services and then you're just waiting for reimbursement. Sometimes you can wait for like several months. The horror story I heard is like somebody waited for 6 months, and then for the Medi-Cal in California to pay them, and he basically ran out of runways. He bellied up, and then the payment came in. So that you don't want to be that. So managing your billing is really important. And the medical billing is not the trivial. There are a lot of informations. I would say like one thing I was surprised me is NEMT trip is very data heavy. So I mentioned earlier some like if you bill insurance, they typically ask you some insurance ask you to fill a CMS 1500 basically claim forms for the billings. So that's a lot of our providers actually use clearinghouse, the same as other doctor's office. They use that for billings and fill the CMS 1500. So we actually support that. So like getting paid, it's not a given in this market. When you sign a new contract, you need to fully understand how they pay you and what the process they takes for you to bill them, and what information they need. There are so many reasons. your invoices or your report, your billing submissions can be kicked back or like stuck because of
Yeah.
mistakes or missing information.
And even if you're doing it right, it can take a lot of time. Like I talked to someone yesterday who said like, oh, I spent 2 full days. I'm the owner of this service and I spent 2 full days doing my billing at the end of the month. Because he was doing it by hand, not using software or anything. So it's kind of crazy how much work it can be, and nice to have some sort of tool to help out.
Yeah. So
And speaking
definitely,
of tools, I mean, maybe we should jump ahead and start talking about tech. Um,
sure.
so big question here is, I think often there's a tendency to think of tech as sort of a cost center, like something you have to pay. Um, but give us sort of a high level overview. I know you've referred to tech as sort of a revenue, it can be a revenue center for an NEMT service. How does that work?
Yeah, actually, this is a loaded question. So, technology, yes, I understand a lot of people are just worried about like the cost side, but I want to actually analogy, right? So iPhone is a $1,000 a piece. It's not by no means it's a cheap device, but a lot of people buy it. Why? Because the value it creates is just so much. It's really so much more. It truly justifies.
Yeah, I'd
So
pay $10,000 for one, right? If I had no other option.
I know. So in any case, so for NEMT technologies, obviously, most of NEMT softwares focus on scheduling and dispatching. We all know those are super important for your operations. Like if you have a good auto scheduler, and they can save you hours a day, right, for scheduling the trips. If you have a good dispatching features, then very robust features, and then you can actually add more trips, improve your we call the vehicle utilization. Basically, you can add more trips to your existing vehicles.
Mm.
So those are all great things. Like a lot of software support that. But I also want to point out for NEMT softwares, you also want the software to support your booking, dispatching, scheduling, and reporting and billing. Those are the three key areas they have to support because they are all like connected together. And then so like you want like for instance on the billing side, you want the software to help you with billing, not only generate report invoice and really support you with your very classic or hardcore medical billings transmit the trip informations automatically to say clearinghouse or help you generate CMS 1500 forms to support your billing effort. And then another thing, actually, I think most people probably are not aware is really like a good modern software will collect a lot of data, obviously, and then they should really leverage data help you grow your business. So like through obviously dispatching and scheduling, but also through really help you understand your current performances. So like for instance, they can show you the trend report, like see help you understand who are your volume driver, which contract is your volume driver, which means give you the most trips, but not necessarily the corresponding most pays. And who are your margin drivers, like which means their trips
Mhm.
only 2% of your trips, but their revenue can be 4 or 5% of your total revenue. So those are margin drivers. So you can manage them accordingly. And then another thing way they can help you is understand, okay, so you have like your trip changes over weeks, over months. So if you want them to be stable or growing, but if you see the decline the last couple of weeks, then you should really schedule a meeting with the
Mhm.
facility or contract payers to
Yes,
understand.
walk in with a box of donuts and ask what's going on.
Yeah, that will work. That will definitely work, I will tell you. And then another thing is I mentioned earlier, tiered pricing, right? How do you know your tier should be 5 miles or 7 miles or 10 miles? A good technology will tell you, okay, 90% of your trip is actually 5 miles or less. Then when you negotiate the pricings, you want to focus on that 0 to 5 mile tier. Okay, because that one, every single penny will have a much bigger
Mhm.
impact on your revenue. So those are all the things, actually, very things actually a good technology should really support you to help you evaluate your the health the healthy state, the health state of your service, and then pointing out the areas you can actually really work on to grow your services.
Great. So we're almost out of time here. Does anyone have
Mhm.
questions? Feel free to drop them in the chat or raise your hand and go ahead and ask.
While we're waiting for people to ask questions, I've turned the chat on so anyone can put it in there or raise their hand. I had a quick question for you guys. What is one thing that you wish you knew going into this field when you first got into the business in NEMT? One tip, one trick of the trade that you wish you could tell anyone just starting out.
Uh, I would say actually, there are many things actually. This is a really good question. There's just so many things involved in managing and starting these services. I would say you want to actually build a good network in this market. Like if you say I'm shy, like I don't know, but you you have to start making friends, and then even like the other providers in your market, like you build them competitors, but sometimes they can be your I call it a frenemy. So if you always want to have a partner, at least one or maybe two partnering providers in your market because they can share trip. You guys can share trips. If you have a vehicle breakdown and then you don't have a spare ones to take the patient to their appointment, then you can always overflow it to your partnering providers. I actually don't see a lot of folks are doing that. They always feel like they're competitors, but I think actually it can be a really good ways to actually help you managing the service more like easier and as well as actually growing the services.
Great. And one more question from me. I mean, please, anyone chime in with questions if you have them. But I'm curious about, in the situation where I have those, 25 taxis or town cars and I'm starting to get into NEMT, at what point would you recommend starting to think about evaluating NEMT softwares and maybe switching from something that's, good for taxis to something that handles NEMT well?
Uh, it depending on like the payers. So if you are doing mostly private pay, I would say actually you probably can wait until like 2 to 3 vehicles, like you can wait a little bit later. But nowadays, if you contract with brokers off the bat, then most likely you have to use adopt softwares because brokers, like in recent years, when they bid contract with health plans payers, they are all required to provide data. So because the payers want the on-time performance measurement, data driven, as well as compliances. So data is very, very data heavy with the broker side, especially and also it's good for you to adopt softwares on day one when you sign up with the brokers because some brokers are actually managing billings on their own. So like if you can like if you have a software electronically communicated or API integrated with the broker systems, then you can actually like get billing done fairly like relatively easily. So and also you can get paid quickly. So those are really the good things. I would say nowadays with all the mobiles and now even AIs, I would say technology. You want to actually adopt the technology as soon as you're like you want to or you're ready.
Got it. And Larry had a question. I'm just asking a quick clarification. Two-part question. Second part was, how do what was it? Do you recommend a lower rate to start with to get your foot in the door? I would say yes, like, but do a time limited offer. Say like, for the first month or first 3 months, I'll give you this lower rate. And then that sort of gives you room to have the price go back up naturally without offending them and saying like, oh, you change things out as a bait and switch.
Yeah, that's a really good point. Yes, like new providers, they want to actually lower the rate. I can totally understand. First of all, the rate in your market, like I mentioned earlier, the rate in your market is decided by the market. Okay, so like there is a balance, right? So that's the rate. Actually, most providers can still have a profitable business, and then payers doesn't have to pay too much. So that's a market adjusted rate. So if you go into too low, without using the strategy James mentioned, then you're at risk that being like running out of like, how do I say, like have too thin of a margin. You may not actually survive the market. That's one risk you are taking. And then another one's actually you are really how do I say, harm or like stir the market with your low rate and then make the other providers not happy. So that's one. So one thing actually you could do, it's really what James was saying, use a promo code discount, like a new provider discount, or saying, oh, we have a new like promotions for this month. So time box your low rate so that people understand you are not really trying to destroy the whole market by going in, etc.
Yeah, Larry clarified the first part. He says, you know, if you're calling a nursing home trying to get a contract, do you want to talk to the GM? Do you want to talk to the shift manager? Do you want to talk to the case manager? Who is the person to talk to?
Okay, so first of all, actually, it's not like they do have a directory you can figure out. Typically, the transportation management, the name is either transportation director or activity coordinator, or like so basically, as if you have a contact in the facility, ask them who are actually the one in charge of transportation. That's the one you want to talk to. Okay, but if you are talking about large hospitals, larger organizations, so I would say talk to, you have more people you need to talk to, like the person who sign contract, also the person who make the calls, right? Sometimes like they always multi-sourcing, which means every payers, they will have a list of providers they can call because they can't really do sole sourcing. So you have this list, 6 or 10 providers. So boil down the calls, it's nurses or caretakers, they will call you, right? So you have to talk with those nurses or caretakers so that you can be the first to call, or you can be always on like
right.
on
Yeah,
top of her
you want to
mind.
be their favorite. And I should mention, we're about out of time. We do have a special offer if anyone wants to sign up with Duet with us. We are doing March and April free. So just go ahead and like go to our website and book a demo with us and chat more. We're also happy, like even if you don't want to buy software right now, if you just you have some more questions, you want to meet with us, we're happy to just chat about the NEMT industry and share what we know. We've got our emails down there, or like I said, you can book a demo on our website and just say, hey, I saw you at the webinar and I had some more questions.
Yeah. I see Larry has another question. Larry, you can actually our emails and phone numbers are in the slides. You can feel free to email us with that question about the contract. Yeah, we have some templates. Happy to share.
Great. And also, I'll send your information to everyone when I send them the recording.
Awesome. All right. Well, thank you, everyone.
Thank you. Thanks everyone. So yeah, great meeting you.